In many traditional cultures, women aren't allowed to own or inherit property. Losing a husband through death or divorce can be a guarantee of poverty.
He snatched away my clothes and traded them for beer. He made life very difficult for me.
He wanted us to divorce. And specifically, it was because he says I couldn't give him a child.
Every time the man has got total authority.
Hello and welcome to Africa Science Focus, a SciDev.net production. I am Selly, Amutabi.
Okay, zina langa ndine Memory Alexander. Nayogera Palombe.
My name is Memory Alexander and I came from Palombe district. I got married to a man and we were staying together at his home in Blantyre. We stayed together for a year and some months before I started having conflicts with his relatives. My husband then told me to go back to my village and promised to call me back when he rents his own house. But time was going without receiving a call from him. He later told me that I could get married because he was no longer interested in me. I was heartbroken. I went to his relatives to discuss the issue, but they said they had no problem with me. I was so hurt that I thought of committing suicide. But when I thought of my young child, I decided to keep going. I tried to seek advice from my friends, but they never helped. Some were even put the blame on me.
We just heard Memory Alexander from Malawi speaking of her previous relationship and the impact it had on her mental health. Malawi lacks an approved mental health policy, nor is it referenced to in the General Health Policy. In fact, there is currently no mental health plan at all. The World Health Organization estimates that psychiatric disorders contribute to 4.3% of the global burden of disease, making it an important and well-recognized issue that requires attention. Reporter Charles Pensilo went in search of those shedding light on mental health, speaking to individuals who have recently filed for divorce, how this life event affected their mental health, and how they were able to seek help.
There is a significant increase of population in Africa, but the rise comes with social problems as well, including those on mental health. Some have described mental health challenges on the continent as invisible yet devastating. There is also fewer number of mental health professionals and infrastructure, meaning people have little chances of seeking professional help when they need it. This is Charles Penslow, and from Blantyre in Malawi, I'll be talking to people who have experienced life issues like divorce and how these affected them.
In terms of percentage, it's very difficult to estimate because I don't have data. But based on what we hear, which we can speculate, there have been a lot of divorce recently if you compare to maybe 10 years before.
This is psychologist John Kuyoka. Here, he describes the possible reasons responsible for the recent increase in separation.
Now I'll start with economic change. If you see the trends of maybe 10 or 20 years, there have been a drastic decrease in terms of our economy performance. And one of the main causes of divorce is financial problem. For example, as a man, culturally, you are expected to provide for the family. But how would you provide for the family if you don't have money? And then you have issues of expectation. So likely, if you had a misunderstanding of what is all about marriage, you are likely to divorce. If you look at how our parents got involved into marriage, they were more of arranged type of marriage. So you'd marry to someone within your communities, within your cultural beliefs. So that makes someone to be at least prepared and able to handle the problems within the cultural context. But we see that these cultural issues are no longer important. whatever culture background, what matters is you like each other, you love each other. So that kind of issue where culture is no longer an instrument that facilitate our relationship, our marriage, might have a problem. Why I'm saying might, because we don't have evidence that maybe I don't have peer-reviewed work that would do publicly say that. But based on the trends, that's what we are seeing. Yeah.
Malawi's constitution states that women are entitled to a fair disposition of property after a divorce. But due to social norms, separated women or widowers are often prevented from claiming ownership of land. Japhet Banda tells Africa Science Focus how economic hardship led to the end of his marriage and a deterioration in his state of mental health.
All right, my name is Japhet Banda. I'm 33 years old. Regarding my divorce with my spouse, it's been some months now after we divorced. During our courtship, everything was going on quite well. We were far apart from each other, right? She was staying somewhere close to Lilongwe and I was putting up in Planta, and then we would just meet here and there. So it was very difficult for us maybe to know some other aspects of the other person. Yeah, because people tend to hide some of their true colors. But then when we decided to come together, we had some two good months of staying together. And then it was a coincidence of me losing my job, where I was working.
Japhet says that his job loss created tension in his marriage.
The issues were just escalating now to the extent that we wouldn't talk for a month. Then that's when I said, come on, if this is the way we are to stay, then it's better that we should separate. It was really hard for me. I never felt like I was worthy, or maybe I'm not somebody who is capable of loving. And if I'm to get married to another girl, am I not going to face the same thing in future? Those are the things that really feel so bad to me.
Japhet relied on the help of his friends to support him during the difficult time immediately after his separation. Connecting with other people can help mental well-being. It builds a sense of belonging and self-worth whilst allowing you to share positive experiences. But sometimes it isn't enough. Japhet told us that he didn't feel confident in approaching a psychologist or a medical professional.
To my understanding, mental health is all about having a mind free of stress. It's very worrisome to see that many people who are in such situations do not get help. A development which we feel does not contribute towards good standards of living. So I think some people are afraid of expressing their problems, are afraid of being stigmatized. Yeah, there are some reasons that people can be refraining from seeking help.
Mwai Nyekanyeka, who you just heard, sees the stigma where he teaches at Wisdom Private School. Mental health issues include a broad variety of illnesses. These range from anxiety to depression to eating disorders, to name but a few. Mwai says that those suffering from mental health fear being stereotyped and discriminated against. In order to remove prejudice concerned with professional mental health care, we return now to John Kuyoka, where he describes the method that psychologists follow when treating their patients.
Yeah, for us as psychologists, the model that we use is we believe a client or someone who is going through a problem has his or her own capacity to manage her situation. Yeah, so that's our model, because that's what we believe, that why people are in problem is because they don't know what they are going through. So what we do is facilitate them to know what they are going through and then make an informed choice.
Of course, as with much of Malawi's healthcare, these services are severely under-resourced. Luckily, there are other services available. The Friendship Bench uses volunteers in the community to help provide a free clinic on park-like benches throughout the country, helping to alleviate stigmatization and provide support.
Hello, my name is Duncan Majichi. I work for a very well-known mental health organization here in Zimbabwe called the Friendship Bench. So the Friendship Bench was founded in 2006 by Professor Dickson Chibanda as a way of reducing common mental disorders. The mission for the Friendship Bench is to create safe spaces and a sense of belonging in communities. We are guided by our values of empathy and connection.
The Friendship Bench was originally introduced to Zimbabwe in 2006. The creator Dickson Chibanda and his army of 400 grandmothers helped over 30,000 individuals in 2017 alone. Now, this groundbreaking mental health program has spread to Malawi and beyond.
The Friendship Bench, it's research-based because we believe that research is our pillar of everything that we do. We have a team of clinicians who are responsible for training lay health workers, grandmothers, grandfathers. The trainings are done so that they deliver the problem-solving therapy. What we call the problem-solving therapy is a component of the bigger picture of the cognitive behavioral therapy. So the problem-solving therapy is trained to lay health workers as a way of task shifting. As you know that here in Africa, there is a lack of mental health specialists, and if they are available, they are always busy and a bit more expensive in terms of reach. So the problem-solving therapy is a one-to-one talk, and after a series of about 6 sessions or less, the person is invited to join what we might call a support group. We term it the Seko Kubatana Tose. Sharing of opportunities, sharing of experiences of how their lives are going through, and income generating projects also, which are opportunities that they can engage in.
But we aren't quite finished yet. Let's hear from this week's guest caller and see what question she has for us.
Hi, Africa Science Focus. My name is Agnes Simeon. I listened on Blantyre. I would like to know why these days children are becoming of age than before. It is because of food, or there could be other factors. Thank you.
After some observations over time, we have observed that looking at the American theory, it could be true. Now, my explanation is that there is an interplay between internal and external environment. Internal environment, I'm talking about how hormones are produced, because it is hormones that lead into progression of such maturation, such as puberty. Some of the foods, they contain what we call endocrine disruption chemicals, called EDCs. These are foods that contain chemicals that affect the production of hormones in the body. So they cause the hormones to be produced too early, too fast, or for the axis where these hormones are involved in the movement and the transportation and the production to mature too early, too fast. The endocrine disruption chemicals, EDC. This is according to the American theory. But the general consensus in the other side seems that there is not really that much evidence that they're going into men are too early.
Thank you, Agnes and pediatrician Dr. Msekandayan for this week's Q&A. If, like Agnes, you have a question, you can get in touch. Send us a text and we'll have an expert answer it for you. Contact us via WhatsApp on +254 799 042 513. You can subscribe to our program, download episodes, and leave a review at www.scidev.net. Today's program was produced by Harrison Lewis, the editor was Jacques Parafatoye, and the reporter was Charles Pensilo. I'm Selly Amutabi. See you next Wednesday. This program was funded by the European Journalism Centre through the European Development Journalism Grant Programme with support from the Bill and Melinda Gates Foundation.